I am 46 years old. I am third generation colon cancer, and there are 5 people in the bloodline. So my screening started very early, about 12 years ago.
We were extra diligent about making sure that we followed through with appointments with the doctors to try to figure out what was going on.
I was diagnosed in November with cancer of the sigmoid colon. So it was a very difficult, trying day for our family to go home and tell the kids that Mom has cancer. No one wants to say it, no one wants to hear it, but sometimes that's part of life.
Jennifer gets a colonoscopy and is found to have colorectal cancer. Fortunately, these problems are usually very treatable. When I see them, my goals are to have an honest discussion with the patient and the family, make sure they understand what the options are, and provide them with the long-term care that they need.
My husband and I felt an immediate connection with Dr. Eberhardt. Dr. Eberhardt was a second opinion, but he was our first choice in the end by far.
What really stood out and made a great first impression with us was the connection, the bedside manner, and his attempt to care for us as people. Dr. Eberhardt really discussed 3 potential treatment options. One was the conventional surgery, a second was laparoscopic surgery, and a third, which was new to us, was robotic surgery.
My mom was diagnosed 12 years ago. Same diagnosis. She ended up having the open traditional surgery to have her sigmoid colon removed as well. It was a difficult recovery, so the robotics seemed to make sense.
The robot technology allows us to visualize things and perform movements that are a lot more difficult to do during standard laparoscopy.
I had an amazing recovery. I was up and walking around within 24 hours. I was in and out of bed without assistance the following day.
Jennifer is one of the toughest, most motivated, engaged, and nicest patients I've ever had. She recovered quickly, she had no problems, and she is progressing nicely.
Throughout this journey, every step of the way it's gone better than what we expected it to be, and it seems like it's gone better than what even the doctors and the nurses and the team thought it would be.
I always felt like in that moment, I was the most important patient in that whole hospital. Last week, we told Dr. Eberhardt goodbye. It was a great appointment, but kind of bittersweet because I feel like he walked this journey with us, and he was privileged to. He made it feel like it was his honor to help us get through a difficult situation.